This is Kylie King. This is my persuasive speech, and here's my audience scan. Okay. All right, this is my persuasive piece, and I will be talking about universal health care that should be free to everyone in the United States. Providing universal health care at no cost to citizens is not just a moral obligation, it is an economic and social necessity for all. It ensures inequity, improves public health, and ultimately strengthens society by eliminating financial barriers to those that might have them. What would you do if you woke up tomorrow and you had a life-threatening illness and you could not get your treatment due to cost? What if it were your mother or your father or even your child? Should survival really be based on financial status? At some point in life, we all face a health crisis, whether it be a sudden accident, a chronic illness, or caring for a loved one in need. Now, imagine during those moments of distress, the biggest concern wasn't to get better, but how to afford the health care. Medical bills start piling up. Financial burdens are really a burden. Healthcare is something every single one of us need. It should not be reserved for only those who can't afford it. As a healthcare professional myself and a student studying public health, I have gained insight into the systemic barriers that prevent people from accessing care. My knowledge and experience provide a well-rounded perspective on the benefits of universal healthcare. Today, I will discuss why universal free healthcare is a moral necessity. First, I will explain how eliminating financial barriers improves the public health and saves lives. Eliminating financial barriers to health care is one of the most effective ways to improve it. When individuals cannot afford routine checkups or initial treatments, preventable illnesses escalate into life-threatening conditions. In contrast, high medical costs discourage a lot of people from seeking treatment, leading to delayed diagnoses and worsening of their health in general. By ensuring free healthcare access in the United States, regardless of financial status, we create a healthier society where medical care is based on need rather than income, ultimately saving lives in the process. According to a statistical information on UICC website, at least half of the world's population still do not have access to full range of essential health services. It's quite staggering. According to the latest estimates of World Bank website, 4.9 million children died before their 5th birthday in 2022. While this is historically the lowest rate of child mortality, children continue to face unequal chances of survival based on where they are born and where they live and their financial statuses. Another statistic located at the UICC website states that over 800 million people use at least 10% of their household budgets for out-of-pocket health expenses. The Commonwealth Fund website states that the United States alone does not have universal health coverage. Nearly 90% of the population was estimated to have coverage in 2018, leaving 27.5 million people, or 8.5% of the population, uninsured. That is a lot of people. Millions in the United States struggle to afford medical care. The answer is clear. Universal free health care ensures that every person, regardless of income, race, or age, has access to the health care they need. The solution to health care in inequality is simple. Implementing universal health care that is free for everyone. By removing financial barriers, we ensure that every individual receives necessary medical attention without fear of debt or denial of care. According to the World Bank website, the World Bank aims to support countries in delivering quality, affordable health services to 1.5 billion people by the year 2030. This is part of a larger effort to provide basic standard of care through every stage of a person's life, including infancy, adulthood, adolescence, and so on. This means that everyone, regardless of age, can get the health care they need. Organizations like the World Bank Group are aiming to help with this. The National Library of Medicine suggests one possible way that Americans can achieve this universal health coverage. A single-payer, government-run system would cover everyone without barriers based on ability to pay. Single-payer systems are more equal. They have lower administration costs, greater user satisfaction, and better quality and access, the report said. However, such a system may restrict spending, leading to shortages of services, delays in elective treatments, and limits on the people's freedom to choose. To deliver on this promise, countries need to have strong, efficient, and equal health systems that are rooted in the communities they serve. Primary health care, PHC for short, is the most effective and cost-efficient way to get there. Primary care covers a lot of individual services, leading from colds to flus to cuts, stitches, any kind of basic care. That alone is important in achieving universal health care. The AAFP website also discusses how primary care can be beneficial in America for free universal health coverage. Their policy states to ensure health care coverage for everyone in the United States through a foundation of comprehensive and longitudinal primary care, from the AAFP 2019 website. Not only in America, but all over the world, if we adopt these solutions to free universal health care, everyone will benefit, young and old. Imagine a world where no one hesitates to seek medical treatment, regardless of what their conditions may be, due to cost. Picture a mother bringing her sick child to the doctor without worrying about insurance or expensive hospital bills. Let's look at England and their free universal health care system as an example. According to the Columbia University School of Professional Studies, the United Kingdom provides public health care to all permanent residents, about 58 million people worldwide. Health care coverage is free at the point of need and is paid for by general taxation. About 18% of a citizen's income tax goes towards health care, which is about 4.5 of the average citizen's income. So it looks like it's a lot, but when you break it down, it's really not that much that goes towards it. We have the knowledge, the resources, and the moral responsibility to ensure that healthcare is accessible to everyone, regardless of financial status. No one should have to choose between their health and their livelihood. It is time to take action. Demand policy changes, support leaders who advocate for universal health care, and raise awareness for life-saving benefits of a system that prioritizes people over profits. The choice is ours. Will we stand by and allow medical care to remain a privilege, or will we fight for health care as a fundamental right? The time for change is now. Let us make universal free health care a reality for all.